What can you do to ensure that your scar heals as beautifully as possible after surgery? The first thing is to make sure that you adhere to activity restrictions that are placed by your surgeon. These restrictions are put in place to ensure that there are not opposing tensions to where we want that scar to be healing into a nice, thin, beautiful line. That's the first thing you can do. The second thing you can do is scar massage. I have my patients start this about 3 weeks after surgery. You take a little bit of hypoallergenic lotion, put it on the scar, and then just do a real gentle massage. I have them do that once a day for the first year after surgery. The third thing you can do is avoid the sun or make sure you have a really good sunscreen on that incision. Oftentimes, I think that patients remember to put sunscreen on their face and maybe their neck, but they forget other areas like their arms or their legs. So if you have an incision there, make sure that you are wearing sun protective clothing or using sunscreen and applying it quite frequently. The next thing you could do would be to consider using silicone taping or sheets. Studies have shown that silicone sheets can improve the appearance of the scar if they're worn for a lot of hours of the day after surgery. This is something that I commonly discuss with my patients, but I largely do breast reconstruction. So for those scars, I just don't think it's worth it. I don't think that the improvement is that great, and usually those incisions aren't under too much tension. Now for me, if I had an incision on my face, I would obviously want to maximize how that incision healed. I probably would consider silicone tape. It's not very expensive, and it might be something to consider as its low risk potential reward. There's also things interestingly like onion extract, which are in some scar lotions, which have also been shown to improve the appearance of the scars. You could use a lotion like this when you're doing your scar massage if you wanted. Now, let's say your scar healed in a way that you just don't like. It's thick, it's hypertrophic, it's wide and it's ugly. What can you do? There's actually a couple things. The most drastic would be doing a complete scar revision, which is where we cut out the scar and just redo it. But there's other less invasive things that you could consider as well. You can laser treat scars that can help reduce the appearance of the scars. You can actually tattoo a scar to add some of your skin pigment into the scar and disguise it. You can also do things like dermabrasion, which is basically like taking sandpaper and sandpapering down a scar to make it look less raised. But those are some things that you would want to discuss with either your plastic surgeon or a dermatologist or someone who has a lot of expertise in that area. If you had a scar, what did you do to help its appearance? Did I miss anything? Let me know below.